Okay, good morning. This is John. It's March 17th, the morning of March 17th. Um, I've been asked to, um, so my daughter came home from college yesterday because her college was shut down for spring break, and then, of course, for the next month at least. And I decided to bring the family. She brought her boyfriend, and her cousin is here as well. So I have, a house full of young adults, and I've been studying this coronavirus thing since early February, and I've been preparing for it. I've been following enough people that saw this coming that I was able to take some preparation myself, and and I think there's a lot of confusion out there about COVID-19, and why all this is happening. Isn't it just this just a big panic? And trying to explain to the kids why this is not a panic, why this is actually very appropriate action on the part of all these countries to stop activity. I get it. I totally get it. And so anyway, I decided to make a video about it because they said, hey, this is really good information. You should probably create a video and send it out there so that people can understand what's going on. So I think I'm going to do a series of videos starting with this, sort of explaining why things are the way they are. And then, and I'll get better at this. I've never done this before. So you can obviously see I've got, my video capture, stuff up, and I don't even know how to do this, but I'm going to try to do it and show you some reasons why this is not the flu. So that seems to be the biggest thing, right? Or at least it was until just recently, is like, why is everybody freaking out? This is just the flu. 50,000 people a year die from the flu, and only 500 have died, from this. Why is this such a big deal? Well, it is a big deal, and there are two main factors, I think, that it is a big deal that contribute to this. One is what's called the case fatality rate, which is if you contract the flu or any virus, what's your chances of actually dying? So with the flu, it's 0.1%. That's, year to year on average, it's about 0.1%. If you contract the flu, you have about 0.1%. So 1 in 1,000 chance of dying. Okay, it's not insignificant. That's pretty significant. But as far as we can tell, and I've gathered this from various sources, and I'm sorry I don't have a list of all those sources, but this is what I've heard from people who are much smarter than me. By the way, I'm nobody. All right, I don't claim any kind of expertise in any of this stuff. It's just a guy that is concerned about his friends and family and himself, and want to try to understand what's going on. So I've done a lot of reading and watching interviews and so on, YouTube videos of people that have researched this. So I'm not claiming I've done any specific research. Anyway, from what we can tell, the case fatality rate for COVID-19 is 1 to 3%. All right, so that's on its face right there. That's 10 to 30 times more fatal than the flu. Okay, that's factor number one. Factor number two is its transmissivity. I mean, how easily is this transmitted from one person to another on average? So with the flu, it's 1.2, 1.3. What that means, there's a measure called R naught, R0, which I assume means rate of transmission, or of transmitting the virus. So 1.3 would mean that if I contract the flu, I on average will infect 1.5 or 1.3 people. Okay, that's what that means. So that's what the flu has been. Well, what we've discovered with COVID is that it's somewhere between 2.3 and 6.0. And that's very significant because this is not like, let's say that it's 2.3 on the low end. That doesn't mean that I infect just one more person than I would if it was the flu. I mean, it does mean that, but it has an exponential effect, because of course that one extra person is going to infect 2.3 more people, right? And then those 2.3 people are going to infect 2.3 people each, and it has this very, very powerful exponential curve that results. Now, to the extent that you increase that up to 4, 5, or even 6, an R naught of 6, that exponential curve is just ridiculous. Now this is adjustable, right? Based on human activity, you can actually adjust the R naught value and suppress it. But the nature of the COVID-19 flu is much more powerful than the standard flu. So these two things are key as to why this is not your standard flu. All right, now let's look at some numbers. Let me change this to 0 real quick. So age range. These numbers were given, these age ranges and numbers were given by the China equivalent to the CDC in early February. There's every reason to believe that the numbers coming out of China are understated. They have not been forthcoming. I think everybody recognizes that it's much worse in China than they have reported. So having said that, we can say that these numbers are probably understated, but we're going to go with them anyway, just for the sake of this thought exercise here. According to them, their cases, we had a roughly an age range of 80% 80 years old plus. About 14%, 15% of people were dying as a result of COVID. And you can see how it goes. It descends quite a bit as you go down the line here. 8% for 70-year-olds plus, 60-year-olds, 50-year-olds, and so on. Now, remember that for the flu, okay, so let me step back here. So the overall case fatality rate is 2.3%. Now remember that for the flu, it's 0.1%. So this is 23 times, according to the Chinese data, 23 times more fatal than the flu if you contract it. Okay, so let's talk about contracting it. What we've also learned from epidemiologists and others is that for global pandemics, you should expect at minimum a 40% infection rate. 40% of the world's population will become infected. As much as 70% and even higher, could be 80%. But I have an active spreadsheet here that we can play with some numbers here and estimate the total deaths. So let's say at the low end, it's 40%. So if 40% of 80 plus year olds get infected in the US, then your average 80-year-old is going to be about 6% at risk of dying. So 6% of 80 plus year olds will die. With if the US population of 13 million, then we should expect 750,000 of 80 plus year olds dying. That's not insignificant. That is very, very significant. And you can see we can just see the numbers, as they drop. And, thank God people, younger folks have better immunity systems. They're more robust immunity systems, I should say. And so they can develop antibodies quicker and in greater numbers to fight the virus. And so the death rate is way down. And you can see that for teenagers, it's more like the flu, in terms of its risk. So we see that with the U.S. population of 330 million, we should expect at minimum 2.5 million Americans to die from this. Worldwide, we should expect about 71 million. And what's interesting about that is that, we do get as I understand, I've just learned this myself, that we get a global pandemic every 100 years or so. The last one was 1918, 1919, the so-called Spanish flu, which wasn't really Spanish, but there was 1.8 billion people on the earth at the time, 1.9, something like that. And they say that at least 50 million people died as a result of the flu, far more people than died in the war. And up to 100 million people. So if you split that down the middle and you say maybe it's 75 million people died relative to the population at the time, that was a case fatality rate of about 4. Okay. which may be what COVID is. We really don't know, and we won't know until this is all said and done. But right now we're looking at a 2.3% based on some Chinese data. So 2.3% of the world population multiplied by 40%, right? That's the low end of the infection rate. It's about 1% of the world population, which is about 71 million people. However, what's more likely is that 70% of people in the world will become infected, which means our adjusted risk looks more like this, which is more like 1.6% of the population, which is, for the US, it's about 4.4 million, and for the world, it's about 125 million people. That's a lot. I mean, hopefully you can understand now why countries are doing what they're doing, because this is a scary number. I mean, that's a significant part of the world's population. On the upper bound regions of 80% infection rate, we're looking at 5 million people in the US, 1.8, 1.9% of the world's population, and 143 million people time. So it's no joke. But how can we battle this? Well, I mean, there's all the obvious things about washing your hands and face masks and all that, and I won't go into that at the moment, but those are all good things, of course. But it's not going to stop the infections. All it's going to do is slow it. There's no way to stop this. I think that's sort of the message that has to get out here, is that this will not be stopped. It will only be slowed. And the way to do that is quarantine. It's the only way to do it. There's very good reasons for that. But the reason we want to quarantine people, and the reason we want to slow this down is, in a word, we do not want to overwhelm our healthcare system. We don't want to overwhelm our hospitals, because people that are, by the way, the vast majority of people that catch this, they either won't have any symptoms, or the symptoms will be so light they'll be like, "What's the big deal? This is not a big deal." Well, it's a very big deal for about 20% of people that catch it. For 20% of people who catch it, they'll need some kind of intensive care. They'll need to go to the hospital. They'll need antibiotics. They'll need, at the worst, they'll need intubation, where they actually need to be respirated mechanically because their lungs don't work, or their lung capacity is diminished to a point where they can't breathe on their own. Well, if you could imagine hundreds of thousands of people flooding into an ICU because they can't breathe because of pneumonia, that is going to overwhelm any hospital, all hospitals, very, very quickly. And it's going to affect other patients that are in the ICU for non-COVID related things, heart patients and so on, that they need those respirators. They, any ICU, apart from COVID, is going to be a very busy place. So imagine if, not if, but when these patients flood in, as they are in Italy right now, Italy is overwhelmed. So what happens is, the red line here, and by the way, I've totally made up this chart. This is not any real data. This is just for illustration reasons only. But, and even these R values these are not values, it's just for illustration. But the idea being that if the infection rate is too quick and the R naught value is too high, we overwhelm this dotted line, which is our ICU capacity in our hospitals. And we get to where Italy is right now, where they have to literally pick and choose who lives and dies based on who gets respirators. And this is where a lot of deaths will occur, because the infection rate is so dang high. But if we can keep this infection rate down by limiting human activity and human interaction, at least on a physical level, then we can keep this curve below the line. And you'll notice, by the way, that the area under each of these curves is the same. So the same number of people are going to be infected. That's not going to change. What's going to change, hopefully, is the rate at which people get infected. So that's what this is about. That's the reason you see all this quarantining, is because finally, government officials have figured this out. Now, this data, by the way, has been out there for months. I've been looking at this for months, and I want to give credit where credit's due. most of what I have here is from Chris Martenson from Peak Prosperity. That's one of the many channels I follow, but that's the one I've been following most in the last 6 weeks or so. And he's called it. I mean, he's called it essentially every step of the way. And he does the deep dive. He deserves the credit for all of this. So I want to make sure that if you want more sort of deep dive look at all of this, click on the link below to Chris Martenson at Peak Prosperity and his almost daily missives on this stuff. So with that, I'm going to close this down because I think it's gone a little long. But I mean, all the obvious things, right? Social distancing, that's all important. Hand washing. If you haven't prepared for this, for food and medicines and things like that, it's probably not too late to get some stuff. I mean, if people are still shopping, I'm probably going to go out shopping today for some last minute things. But yeah, get some food, get some zinc, vitamin C, and actually, I'm going to put out other videos about how to protect your immune system and how to boost your immune system. I mean, it's some pretty obvious stuff, but maybe a lot of people don't know. But there's some household spices you probably have right now that if you can't get to the grocery store, you could probably boost your immunity just with stuff you have in your kitchen. So I'm going to go over that. I'm going to go over some of the economic. By the way, economically, the impacts economically I haven't even touched on, but that is going to be worse, I believe, than the virus itself. The fallout from this on an economic level is going to be tremendous, and we need to go over that as well. So anyway, I'll stop this video for now, and I will get better at this over time, and I'll try to put one of these out a day at least, because we all have a lot of time on our hands right now. And I will talk to you soon. Thanks.